This video has been designed in an audio-friendly format, allowing you to listen comfortably without needing to watch the screen. Whether you're driving, gardening, relaxing, multitasking, or visually impaired, you can enjoy the content much like a podcast. Simply press play and listen along.
I want you to picture something for a second. Really try to visualize this in your mind. Imagine a doctor, right, sitting on a sun-drenched beach down in Cabo San Lucas, Mexico.
Okay. I mean, that sounds pretty nice.
Right. Maybe she's got a drink in her hand, just enjoying the ocean breeze.
Yeah.
But somehow, according to official government paperwork, at that exact same moment, she is supposedly standing in a clinic in California.
Wait, what?
Yeah. She's supposedly in California, personally injecting a patient with Botox.
Mm-hmm.
And to make the physics of this scenario even more bizarre, the patient she is supposedly injecting is currently locked inside a federal prison.
That is, I mean, it sounds like a glitch in the Matrix. Or maybe a really poorly written science fiction script. It just completely defies the laws of physics, time, and, well, basic common sense.
It totally does. But this isn't science fiction. This is the staggering reality detailed in a freshly released Department of Justice document regarding a massive $45 million Medicare fraud conviction.
$45 million, that is just a wild number.
It's massive. And our mission for this deep dive today isn't just to gawk at a wild true crime story, though believe me, the details here are absolutely wild.
Oh, for sure.
Our goal today is to actually understand the mechanics of modern healthcare fraud. We want to look at how these massive schemes operate under the hood, and more importantly, how advanced data analytics is stepping up to become the ultimate detective in the medical world.
Exactly. Because what makes this specific case so incredibly important for you to understand, it isn't just the sheer audacity of the crime itself, it's really about how the crime was solved.
Right.
How did she actually get caught?
Well, there wasn't a guilty conscience here. There wasn't some insider whistleblower who got cold feet and went to the feds. This entire multi-million-dollar empire was literally brought down by an algorithm.
Okay, let's unpack this. The center of our story is a California doctor named Violetta Mailyan. She operated a clinic in Glendale, and it was called the Healthy Way Medical Center.
Healthy Way.
Right.
Yeah, very wholesome sounding. Now, this was pitched as a place for beauty and cosmetic services. But she was just convicted by a jury in the Central District of California on 9 counts of wire fraud and 3 counts of obstruction of a criminal investigation.
And we really need to get into those obstruction charges later because they are just as important as the fraud charges. I mean, maybe even more so when we look at how this all actually unraveled.
So let's start with the anatomy of this $45 million hustle. Because to understand what she did, we have to look at the actual mechanics of Medicare billing.
Right. The system itself.
Exactly. The core exploit here relies on a very specific loophole. You see, Medicare does not care if you want to smooth out your forehead wrinkles, right?
Mm-hmm.
They do not reimburse for cosmetic Botox.
No, they definitely do not.
However, they do reimburse for Botox injections if they are medically necessary.
Yeah.
Specifically to treat documented cases of chronic migraines. So Mailyan took that specific billing code and she just ran with it.
She really did.
She billed for thousands of injections that were either purely cosmetic, unreferred by any primary care physician, or simply never happened at all.
She essentially found a structural crack in the system, and it has a lot to do with how Medicare is actually designed to operate. Because the bureaucratic engine of Medicare, it processes millions of claims every single week.
Millions.
Right. So they operate on what is essentially a trust-based pay and chase model.
Wait, pay and chase. What does that actually mean in practice? Like, how does that work?
Well, it means that when a doctor submits a claim, the system is designed to pay it out quickly. The priority is patient care, right?
Okay, that makes sense. You don't want sick people waiting.
Exactly. If Medicare stopped to manually audit every single one of the millions of claims submitted daily just to ensure absolute accuracy before releasing funds, the entire healthcare system would just grind to a halt.
Oh, wow. Yeah, it would be a disaster.
Total disaster. Grandmothers wouldn't get their treatments. Clinics would go bankrupt waiting for checks. So the system assumes the doctor is telling the truth. If the paperwork says chronic migraines and has the right medical codes, the system automatically pays out.
And the chase part.
The chase part comes later. That happens if an audit flags something suspicious down the road. Mailyan essentially weaponized that efficiency.
And when we say she weaponized it, I mean, we are talking about brazen, jaw-dropping details here. According to the trial evidence, She billed Medicare for over $19 million worth of injections on days when her clinic was entirely closed.
$19 million on days nobody was even in the building.
$19 million. And she billed for that incarcerated patient we mentioned at the start. Plus, she routinely backdated claims, literally billing for injections she supposedly gave to patients before those patients had even made first contact with her clinic.
Which is, I mean, structurally impossible. Just think about the logistics of that for a second.
Right.
It requires you to diagnose a patient, formulate a complex neurological treatment plan, and execute a medical procedure before you even know the patient's name or before you've ever seen their face.
Here's where it gets really interesting to me. I mean, thinking about it from your perspective as you listen to this, it's like turning in a corporate expense report for a business lunch that took place in a condemned building.
Yeah, exactly.
With a client who was literally in jail.
Yeah.
All while you were posting selfies from a beach in Maui. At a certain point, wasn't she basically begging to be caught?
It really seems that way, doesn't it?
Yeah. I just don't understand how she thought papering over this with fake patient consent forms would actually work against the infinite resources of the federal government.
What's fascinating here is the underlying psychology of fraud. It's rarely a static crime. You don't just, wake up one day and decide to steal $45 million.
Right. It's a progression.
Exactly. Success breeds escalation. When someone submits that first fraudulent claim, maybe they just nudge a cosmetic procedure into a medical billing code, and the money quietly appears in their bank account a few days later. It creates a false sense of invincibility.
So she just kept pushing the boundary to see where it would finally break.
Precisely. And she wasn't just stealing money. She was actively fabricating an entire alternate reality of medical records to justify the theft.
Wow.
She was forging patient consent forms to make it look like they suffered from chronic migraines, completely inventing complex medical histories. In her mind, the paperwork was the reality.
So as long as that paper trail existed.
Even if she literally just printed and faked it in her back office, yeah. She genuinely thought she was insulated from consequence.
But the consequences of that false reality were very, very real. And I think that brings us to the spoils of this fraud. We really have to talk about what she bought with all this taxpayer money.
Oh, the purchases are just unbelievable.
It reads like a shopping list from someone who just won the lottery and went into a blind panic. We've got the lavish vacations, of course. Cabo, Mexico, Maui, Hawaii, Las Vegas, Pennsylvania, New York.
The classics.
Right, the classics. But she also bought a Tesla Model X, a Tesla Cybertruck. And then we get to the bizarre collectibles. A $3,000 painting, and I am not making this up, a $12,000 17th century crossbow.
A 17th century crossbow. I mean, it almost perfectly symbolizes the absolute hubris involved in this kind of white-collar crime.
Cool.
You are literally defrauding a modern federal health program to buy medieval weaponry. It's absurd. And
the jury saw right through the extravagance. They subjected a massive amount of her assets to forfeiture. We're talking about the Cybertruck, the Model X, over $250,000 sitting in bank accounts.
Plus the brokerage accounts.
Oh, yeah. Over $7.3 million in brokerage accounts, and 4 different properties in Surfside and Glendale, California, with an estimated combined equity of over $7.3 million.
Which represents a pretty comprehensive dismantling of the empire she built. But as I mentioned earlier, the fraud itself, the fake billing, the Teslas, the crossbow, that is really only half the story.
Right, because eventually if you buy a medieval weapon with government money, someone is going to notice.
Yeah.
Which leads us to the cover-up.
Yes. The cover-up is where it all falls apart.
Investigators did start closing in. A grand jury subpoena was issued, demanding her medical records. Now, if it were me, and federal agents knocked on my door asking for documents, I'd be calling a lawyer and preparing for the worst.
That would be the smart move.
But she didn't surrender. The trial evidence showed she actively altered patient records to make it look like she provided those chronic migraine Botox treatments, and then handed those forged, altered documents directly to federal agents.
She handed them right over.
I have to stop here because this makes zero sense to me. If you know the feds are already subpoenaing you, isn't handing them freshly forged documents essentially the worst possible thing you could do, like throwing gasoline on a fire?
It is the absolute definition of throwing gasoline on a fire. But it happens surprisingly often in these cases. Those obstruction charges, which carry a maximum penalty of 5 years in prison each, they often seal a fraudster's fate faster and more firmly than the original crime.
But why is that? I would think stealing $45 million is the much bigger issue here.
Well, the theft is the bigger monetary issue, certainly. But legally speaking, obstruction changes the entire battlefield because it completely eliminates the defense of incompetence.
Okay, walk me through that. How does that work in court?
So when a doctor faces billing fraud, their first line of defense in a courtroom is almost always, is an administrative error.
Oh, the old "my accountant did it" defense.
Exactly. They will argue, my billing department made a mistake. I am a doctor, not an accountant. I didn't understand the complex Byzantine Medicare coding system.
And to be fair, that coding system is pretty complex, right?
It is incredibly complex. It can be genuinely hard for a prosecutor to prove beyond a reasonable doubt what was actually in a doctor's mind when a wrong code was entered 3 years ago. Was it malice or was it just a clerical mistake? But when you receive a federal subpoena and your response is to take out a pen, alter a medical record, and hand it to a federal agent.
Wow, okay, I see. So by trying to cover her tracks, she accidentally handed them the exact weapon they needed to destroy her administrative error defense.
Precisely. That physical act of forgery transitions the crime from a passive, debatable billing error into active, provable, malicious intent, or what the legal system calls mens rea, a guilty mind.
Mens rea, okay.
Great. It proves to a jury that you knew exactly what you were doing, you knew it was illegal, and you were actively trying to hide it.
That makes total sense. You really can't accidentally forge a consent form while under federal investigation.
Yeah.
Okay, so she's confidently handing over forged documents to federal agents, thinking she's outsmarted them.
Yeah, she thought she was in the clear.
But what triggered the subpoena in the first place? How does she even get on their radar? Because like you said at the beginning, there was no whistleblower here.
And this is where we see a fundamental shift in how the government hunts for this kind of crime. This entire operation was brought down by the DOJ Fraud Division's data analytics team.
The data analytics team?
Yes. This wasn't a case of a disgruntled patient complaining or an eagle-eyed auditor randomly pulling her file at a stack of millions. This was just pure mathematics.
Let's break down that math because it is staggering. Over a 4-year period, Mailyan received more than $24 million from Medicare just for Botox injections.
And out of context, 24 million is just a very large number. A busy hospital might bill that in a week. But data analytics is all about context, and it's about clustering.
How so?
The data analytics team ran the numbers for every single doctor in the United States. They didn't just find that she billed a lot. They ran anomaly detection algorithms and found that she was paid 6 times more than the next highest group of providers.
6 times more. And who's that next highest group? I assume they were specialists.
They were all neurologists, actual board-certified specialists whose primary daily job is treating severe neurological conditions, including chronic migraines.
Wow.
Yeah. Violetta Mailyan, running a cosmetic beauty clinic in Glendale, California, was billing 6 times more for complex migraine treatments than the top neurological specialists in the entire country. She was, in the words of the DOJ, an extreme outlier.
I really want to make sure we grasp how this technology works. Because it's not just looking for a big number. It's like trying to find a counterfeit bill.
Okay, I like that analogy.
In the old days, an investigator might hold a suspicious $20 bill up to the light, checking the watermark, right? It's slow manual work. But this data analytics team, they aren't looking at individual bills.
Right, they are looking at the whole system.
Exactly. It's as if they have a system that instantly scans the serial numbers of every single dollar bill circulating in the entire global economy. And the computer instantly flags the one serial number that appears 10,000 times.
That is a perfect way to visualize it. If we connect this to the bigger picture, what we are seeing is a massive paradigm shift in law enforcement strategy.
Right.
Historically, investigating healthcare fraud was incredibly labor-intensive and entirely reactive. You waited for a tip on a hotline, then you gathered physical files, then you had medical experts review individual claims one by one. It took years to build a single case against a single doctor.
It sounds absolutely exhausting.
It was, but now they are proactive. They are ingesting massive terabyte-sized data sets. They are utilizing clustering algorithms to group doctors by specialty, region, and billing patterns.
So they see everything all at once.
They do. They scan millions of codes across the entire country simultaneously. They are looking for statistical anomalies that human eyes would inevitably miss. They don't need to wait for a tip. They just let the math point them to the crime.
And it's not just one clinic in Glendale that they are looking at with this tech. If we zoom out to the macro level of healthcare fraud, the federal response detailed in this document is huge.
It's a massive national effort.
They talk about the Department of Justice's Healthcare Fraud Strike Force program. They currently have 9 strike forces operating in federal districts across the entire country. And since 2007, this program has charged more than 6,200 defendants.
And those defendants collectively build federal healthcare programs and private insurers an almost incomprehensible amount of money, more than $45 billion.
$45 billion. That is a staggering sum.
It really puts Mailyan's $45 million into perspective, doesn't it?
It really does. It's just a drop in the bucket.
And the government is actively restructuring to try and capture more of this. According to the document, on April 7th, the Department of Justice announced the creation of a new dedicated fraud division.
Right. And I think we need to be explicitly clear here for the listener.
Yes, absolutely. We are impartially reporting the contents of this DOJ press release. We are not taking any political sides or endorsing the viewpoints of the administration. We are simply conveying the facts of the government's current structural response to this issue as written in the source material.
Exactly. Strict neutrality. We are just looking at the policy mechanics here. So the source material explicitly states that this new fraud division supports President Trump's task force to eliminate fraud.
Which is a whole-of-government effort.
Yes, chaired by Vice President J.D. Vance, and aimed specifically at eliminating fraud, waste, and abuse within federal benefit programs.
And it is deeply important to understand why these task forces and strike forces exist in the first place. Because it's really easy to look at a story about a doctor buying a $12,000 crossbow and think, well, she stole from Medicare.
Right, it feels detached.
Exactly. People think Medicare is a giant, faceless government entity with an infinite budget. It's basically a victimless crime. But the FBI's Los Angeles Field Office Assistant Director, Patrick Grandy, made a very specific point in this document about who actually pays for this.
And who is that?
Well, he pointed out that physicians who fleece Medicare are doing so at the direct expense of American taxpayers. Healthcare is essentially a massive shared risk pool.
Right, we all chip in.
When billions of dollars are drained from that pool through fraudulent billing, it doesn't just disappear into the ether, it directly destabilizes the economics of the system.
So it hits our wallets.
It absolutely does. It drives up premiums and it drives up co-payments for law-abiding citizens. Every time someone buys a Cybertruck with fake Botox claims, it makes legitimate healthcare more expensive for you, for me, for everyone listening. It is quite literally a hidden tax on the public.
Which is infuriating.
Yeah.
But it also makes me wonder something. I have to push back a bit here on this whole data analytics thing.
Okay, go ahead.
If the government has these incredibly advanced data analytics teams now, and they can instantly spot an outlier from a mile away, like scanning those serial numbers, how are we still seeing billions in fraud?
That is the billion-dollar question.
Right. Are we just treating the symptoms after the money is already spent on vacations and 17th century crossbows? If the algorithm is so good, why is the problem still so massive?
Well, this raises a really important question about the nature of the ecosystem itself. It is a perpetual cat and mouse game. Think of it like cybersecurity.
Okay, like hackers and firewalls.
Exactly. The moment you build a better firewall, hackers start designing a better virus. As detection gets better and the algorithms get sharper, the criminals adapt. The low-hanging fruit, the doctors billing for $19 million on days their clinics are physically closed, they get caught by the data relatively quickly now.
Right, because they are sloppy. They stick out.
Exactly.
Yeah.
But the sophisticated fraudsters, they watch these convictions. They read these DOJ press releases just like we do. They learn exactly what the algorithms are flagging.
Oh, wow. So they adjust their behavior.
Yes. This forces agencies like the HHS OIG, that's the Health and Human Services Office of Inspector General, the agency tasked with auditing these programs to constantly refine and evolve their own algorithms to protect federal healthcare programs.
It's an arms race.
It is an arms race of data. The moment the government identifies a new pattern of fraud, the fraudsters invent a new way to hide it.
An arms race of data. That perfectly captures what we are looking at. And for Violetta Mailyan, that particular arms race has reached its conclusion.
It certainly has for her.
Looking at the timeline in the document, she is currently awaiting sentencing, which is officially scheduled for September 10th, 2026. A federal district court judge will determine her exact sentence, but she faces a maximum penalty of 20 years in federal prison for each of those 9 counts of wire fraud.
Plus an additional 5 years in prison for each of the 3 counts of obstruction.
The math on that potential sentence is just as staggering as the fraud itself.
It really is. But as we wrap up this analysis, I want to leave you with a final thought to mull over, building on what we just discussed about this arms race of data.
All right, what is it?
Well, we just saw a federal algorithm easily catch a doctor who was incredibly sloppy with her fraud. She was greedy, she stood out 6 times above the norm, and she was caught.
Right, she was an extreme outlier.
But as data analytics gets smarter, so will the criminals. We are entering an era of incredibly powerful, accessible artificial intelligence. What happens when the fraudsters start using their own AI to perfectly mimic the billing patterns of average, law-abiding doctors?
Oh, wow. That is a chilling thought.
What happens when their algorithms ensure they are never an extreme outlier, blending their fraud so seamlessly into the background noise of the healthcare system that no human and no current federal radar gun could ever spot it?
The perfect crime, executed by a machine, just to ensure the doctor stays perfectly hidden right in the middle of the bell curve. It makes you realize that as wild as this case is, it might just be the end of an era for this kind of sloppy, brazen fraud. The next generation of this crime won't involve crossbows and closed clinics. It'll be quiet, efficient, and deeply hidden.
Unsettling, but probably true.
Well, we want to thank you so much for joining us on this deep dive. Keep questioning the data around you, stay curious, and the next time you picture a doctor relaxing on a beach in Cabo, just hope their medical records aren't actively being updated while they sip their drink. We'll catch you next time.